This video will cover the foundational concepts of first aid, a crucial skill set that can save lives and mitigate the severity of injuries and illnesses. We will focus on understanding what first aid is, its importance, and the basic principles that guide its practice. First aid is the immediate assistance provided to an injured or suddenly ill person before professional medical help arrives. The primary goals are to preserve life, prevent the condition from worsening, and promote recovery. It involves simple, life-saving techniques performable by anyone with appropriate training. First aid is important because it provides an immediate response in emergencies when professional help may take time to arrive. Proper first aid can prevent complications and enhance the effectiveness of subsequent medical treatment. Furthermore, effective first aid can be the difference between life and death in critical situations. Knowledge of first aid also equips individuals to handle emergencies confidently, reducing panic and improving outcomes. The principles of first aid begin with assessing the situation to ensure the scene is safe for both the rescuer and the victim. Next, call for help immediately, providing clear and concise information to emergency services. Then, administer appropriate first aid based on the victim's condition, such as performing CPR or controlling bleeding. Finally, continuously monitor and reassure the victim to reduce anxiety and help keep them calm. As a first aider, your responsibilities include assessing the situation quickly and safely, and summoning appropriate help. You must protect casualties and others from danger, and identify the nature of the illness or injury. You are also responsible for providing early and appropriate treatment, treating the most serious condition first. Arrange for the casualty's removal to a hospital or into the care of a doctor, and remain with them until appropriate care is available. Basic first aid techniques include CPR, a critical technique involving chest compressions and rescue breaths when breathing or heartbeat stops. Also, learn choking relief techniques like abdominal thrusts to dislodge airway obstructions. Other techniques include bleeding control by applying direct pressure and using bandages to protect the wound. For burn treatment, cool the burn with running water and cover it with a clean, non-stick dressing. An effective first aid kit should contain essentials such as adhesive bandages, sterile gauze pads, and adhesive tape. Include antiseptic wipes, tweezers, scissors, a digital thermometer, disposable gloves, a breathing barrier, and a first aid manual. Risk assessment involves identifying hazards like traffic or fire at the scene. Evaluate the risks to determine the level of danger and how they might impact the first aid provided. Recognize potential risks that could affect both the rescuer and the victim. Implement control measures to mitigate risks, such as moving the victim to a safer location. Continuously review and monitor the situation, ensuring control measures remain effective and adjusting them as needed. Safety protocols include wearing protective gear like disposable gloves and masks to minimize exposure to bodily fluids. Avoid direct contact and use barriers when performing rescue breaths or handling open wounds. Always practice good hand hygiene before and after providing first aid. An emergency is an unexpected, life-threatening condition requiring immediate attention. Recognizing an emergency involves identifying when someone needs urgent medical care. Key characteristics include urgency, severity, and unpredictability. Urgency means the situation requires immediate action to prevent severe consequences. Severity indicates the condition is critical or life-threatening. Unpredictability means the situation is sudden and often without prior warning. Common emergencies include cardiac emergencies like heart attack and cardiac arrest. Respiratory emergencies include choking and asthma attacks. Trauma emergencies cover severe bleeding, fractures, and sprains. Also, be aware of allergic reactions like anaphylaxis and various degrees of burns and scalds. The initial assessment and primary survey prioritize safety first, followed by checking responsiveness. The critical steps are assessing the airway, breathing, and circulation.